Talk about a major step forward in the fight against diabetes. The drug maker Eli Lilly has announced it's going to cut insulin prices.
Yeah, because some people are spending upwards of $1,000 a month on insulin, especially type 1 diabetics. The company is capping the out-of-pocket cost of insulin, some insulins, to $35 a month. Fox 13 health reporter Mandy Rock explains now how this is going to bring relief to millions of people.
Imagine not being able to afford the medication that keeps you alive. That's the story for many diabetics who rely on doses of insulin to regulate their blood sugar. This cost-cutting announcement is part of a bigger movement aimed at making this medication more affordable.
Drove myself to the emergency room and I barely made it in the parking lot. My blood sugar, I got in there and that was one of the things they checked. My blood sugar was like 500.
Diabetes runs in Nathan Pekela's family. He and his mother rely on insulin to keep their blood sugar in check. But paying for the medication can be a challenge.
If I didn't have health insurance and the coupons that the drug company provides, it would be about $2,000, $2,000 to $3,000.
That's per month. But Wednesday, drug maker Eli Lilly and Company said it would cut prices of several of its insulin products. Lilly also said it would cap a patient's out-of-pocket cost for insulin at $35 a month.
I think this is a huge advancement, but the skeptic in me says that it is not enough and little too late.
Dr. Kashif Latif is an endocrinologist and the medical director of the AM Diabetes Center of America. He said for far too long, patients have turned to dangerous alternatives because they couldn't afford their insulin.
It has been cost prohibitive for a lot of patients, which led to patient rationing their insulin use and not giving as much as needed to control their blood glucose.
Kent Stoneking is a pharmacist and the director of education for the AM Diabetes Center. He said he's had several customers switch to less effective medications because of the high cost.
My hope is that the other insulin manufacturers will take this cue from what Eli Lilly is doing and follow suit, and hopefully to a greater extent and sooner.
Right now, Lilly's website says a vial of Humalog has a list price of $275. Now, keep in mind, patients go through several of these vials every month. The company says they're planning to cut that price by about 70%. In Memphis, Mandy Rock, Fox 13 News.
That's really good. Humalog is one of the insulins that I use, in fact.